the Secretary to the Government of the Federation and Chairman of PTF, Honorable Ministers, Director General, Permanent Secretaries, Directors, ladies and gentlemen. We all are constantly reviewing COVID-19 activities and developments at home and abroad to learn as much as we can about this novel coronavirus disease. We have learned a lot, and among what we have learned, for example, is that patients are most infectious during that asymptomatic period after they are diagnosed and spread the virus even when they do not look or feel sick, or even if their symptoms will appear later, they are already spreading the virus. We also learned that patients who have no symptoms at all, or who have no symptoms but have been sick, may no longer be infectious after 14 days, even if their PCR tests identify RNA evidence of the virus in their system. These are, of course, those who are diagnosed positive and they're asymptomatic. Those with symptoms will continue to receive treatment for the number of days that they are clinically unstable. Global evidence shows that up to 45% of infected persons may have no symptoms at all. In Nigeria, the proportion of confirmed cases that is symptomatic compared to asymptomatic is about 40 to 60, respectively, which means that if 10 persons are able to infect you with COVID-19, 4 of them will look very well, indeed. Another 3 or 4 of them will have mild symptoms that can be trivialized, even by healthcare workers who have experience, and that is perhaps a possible reason for initial relatively high rate of infection among workers. Therefore, the cheapest and easiest way to protect oneself is with a mask. In this case, a cloth mask, not necessarily a medical mask, but we must also make clear that that alone does not do the trick. You must still maintain other measures that are advised: distancing, hand washing, and respiratory hygiene. And this is why the Federal Ministry of Health constantly urges citizens to adhere strictly to all these guidelines, wearing masks when outside your home, and also to all the other non-pharmaceutical measures, especially since the confirmed COVID-19 cases in our country is continuing to rise very slowly, which also gradually increases the number of persons in society who may be positive. If they have symptoms, they'll be in hospital, or they have no symptoms, they're in the community. Yesterday, we had 409 new COVID-19 confirmed cases, which increased the total tally to 13,873. We have successfully treated and discharged 4,351 persons, and unfortunately lost 382 Nigerians to this disease. Although these numbers are only creeping up compared to other countries, and the case fatality rate hovers around 3%, we are concerned and at high alert. We have no room for complacency or overconfidence, and we need to be ready for any sudden shift in fortune. The Federal Ministry of Health, through the NCDC, is activating additional laboratories in Akwa Ibom, Jigawa, and Oyo states, which bring the total number of laboratories in the network to 33. More are being prepared as we work towards a target of at least 1 molecular laboratory per state. Optimization of some laboratories is also going on. We are planning for targeted community sensitization activities, especially in 20 high-burden local government areas with sensitization workshops on infection prevention and control for healthcare workers, both in public and private hospitals, particularly here in the FCT. The Federal Ministry of Labor and Employment, the Federal Ministry of Health, and the House of Representatives led by the Honorable Speaker have been engaging the National Association of Resident Doctors to address issues raised by young doctors. We have had dialogues with them and with other government agencies and ministries, and also with health-related associations. The dialogue addressed issues on welfare allowances for healthcare, for frontline healthcare workers, and redressed issues on personal protective equipment, which have been supplied to all states and to federal teaching institutions for the safety efforts that have been made to address these grievances. The issue about just resident doctors has been resolved by the board, and the remaining are being, as much as I know, I think already in the process or in the pipeline. I wish to thank the Honorable Speaker, Right Honorable Femi Gbajabiamila, and the Minister of Labor, Dr. Chris Ngige, for their commitment in ensuring industrial harmony in the health sector. I would like to use this opportunity to also inform stakeholders and the general public that the much-awaited reforms for operationalizing the Basic Healthcare Provision Fund is about ready after a period of time in which we had to carry out certain corrections which were pointed out by lawmakers. This will be revealed after presentation to stakeholders in the shortest possible time. However, I can see that all errors in the manual have been addressed and corrected, and the new document vastly improves on the earlier one with regard to service delivery package and other features. Finally, I wish to urge everyone to be your brother's keeper, to always wear your mask in the public, observe hand and respiratory hygiene, and do not go out of your house unless it is absolutely necessary. This advisory is particularly important for vulnerable persons and persons over the age of 60, that they should stay in their homes unless there is something absolutely necessary that they have to attend to personally. Thank you.